Welcome back. Today, we're unpacking a topic that's changing how we look at health. The real science behind metabolic syndrome, and why, as Dr. Robert Lustig says, obesity is just a symptom, not the root problem. Who is Dr. Robert Lustig? Dr. Robert Lustig is a pediatric endocrinologist and neuroendocrinologist at the University of California, San Francisco. He's a leading expert on metabolism, obesity, and nutrition, and is especially known for his research on how sugar and processed foods contribute to metabolic diseases. His work has helped reshape how we understand obesity not as a cause, but as a symptom of deeper metabolic dysfunction. So let's start the video. Don't forget to subscribe our channel. What is metabolic syndrome? Metabolic syndrome is not a single disease, but a cluster of conditions. High blood pressure, high blood sugar, excess abdominal fat, and abnormal cholesterol or triglyceride levels. Together, these raise your risk for heart disease, stroke, and type 2 diabetes. But here's the twist. Metabolic syndrome is the real issue, not just the number on the scale. Obesity is just one outward sign. In fact, many people with normal weight can still have metabolic syndrome, and some people with obesity are metabolically healthy. The root cause: metabolic dysfunction. Dr. Lustig explains that the real problem is metabolic dysfunction, especially insulin resistance. Insulin resistance means your body's cells don't respond well to insulin, so your pancreas makes more. This leads to higher blood sugar, more fat storage, and a vicious cycle of worsening health. But what causes this dysfunction? It's not simply eating too much or exercising too little. The main culprit is our modern diet, especially ultra-processed foods high in added sugars, particularly fructose. These foods disrupt our metabolism at a cellular level, causing inflammation and fat buildup in the liver, which then drives insulin resistance. Obesity. Marker, not cause. Here's a key insight. Obesity is a marker for metabolic syndrome, not the cause. Dr. Lustig shows that 40% of people with normal weight have metabolic syndrome, while some with obesity do not. The real danger is not just how much fat you have, but where it is. Fat around your organs, visceral fat, is much more harmful than fat under the skin. Other diseases like type 2 diabetes, hypertension, heart disease, and even some cancers are also markers of metabolic syndrome. They all share the same root: metabolic dysfunction. Why focusing only on obesity misses the point. The common advice, just eat less and move more, misses the real issue. Treating obesity alone doesn't fix metabolic syndrome. You can lose weight and still have high risk if you don't address the underlying metabolic dysfunction. Dr. Lustig emphasizes that the food industry has shifted us toward processed foods that hack our biology, driving us to eat more and crave more sugar, which worsens metabolic health. The role of sugar and processed foods. The explosion of added sugars, especially fructose, is central to the problem. Fructose is metabolized in the liver, where it can cause fatty liver, insulin resistance, and inflammation even in children. Our bodies simply aren't adapted to handle the massive amounts of sugar found in today's processed foods. How to fix the problem? Real food, not fads. Dr. Lustig is clear. The solution is not low carb, low fat, or any extreme diet. It's about eating real, whole foods and cutting back on processed foods and added sugars. Fiber-rich foods help slow sugar absorption and support healthy metabolism. Metabolic syndrome is the real health crisis. Obesity is just one sign. Insulin resistance, driven by processed foods and added sugars, is at the heart of metabolic dysfunction. Focusing only on weight loss misses the bigger picture. Metabolic health matters for everyone, regardless of size. Real food, less sugar, and more fiber are the foundation for reversing metabolic syndrome. Conclusion. Let's reframe the debate. Obesity is not the enemy, metabolic syndrome is. The solution isn't just about losing weight, but about restoring metabolic health through better food choices and lifestyle changes. If you found this video helpful, share it and let's help everyone understand the real science behind metabolic health.